More children are being prescribed ADHD medications, or what are being called study drugs, for mental boosts. A new report from the American Academy of Neurology takes a stance declaring the use of such drugs by healthy kids is unjustifiable. Over the past 2 decades, there's been a 20% increase in ADHD diagnoses. The Centers for Disease Control and Prevention estimated in 2008 that drugs such as Ritalin and Adderall are given to about 3 million kids a year. The problem? According to the AAN, there's a growing trend of children using the drugs as stimulants without a diagnosis of a neurologic disorder. NBC News reports a 2012 government survey suggested between 3 and 8% of U.S. high school seniors said they had taken ADHD medications without a prescription. The AAN described this trend as neuroenhancement. The report reviews the ethical, legal, social, and neurodevelopmental issues related to neuroenhancement and the role of the physician when it comes to prescribing these drugs. According to the new AAN report, it is generally believed that some portion of the increase in stimulant use is attributable to neuroenhancement, especially among older teens. For the AAN, the use of such meds in healthy kids is not only an ethical problem, but also a health concern. Granted, more research needs to be done, but misuse of these drugs can lead to substance abuse and dependency. The AAN puts an emphasis on the doctor's role in neuroenhancement, as they play a key role in who is prescribed the drugs and who isn't. The report encourages doctors to carefully evaluate the child's symptoms. In some cases, a child might be motivated by school failure or pressure for higher academic achievement. The AAN recommends doctors emphasize the little data regarding the efficacy and safety of medications prescribed to children and adolescents who don't have ADHD. Doctors also have the right to refuse prescriptions, as there are alternatives to the drugs. For some students, it might seem drugs like Adderall and Ritalin could give them a competitive edge. Commenting on the paper, one doctor says the goal for doctors is to define the line when it comes to prescriptions, rather than encouraging this trend. To compete, a person has to do more than the next guy. That's the nature of competition. The question is, what is appropriate, and where do we as a society draw the line? However, some doctors are concerned this report might actually confuse parents who are already tentative when it comes to medication for ADHD. I worry that we're focusing too much on the downside, and it will deter people from getting the help they need. We have a lot of good evidence about the use of medications, and it is clearly effective in the short term for treating the symptoms you see with ADHD. AAN doctors call for more research on the long-term effects of the drugs in healthy kids. For Newsy, I'm Lauren Zima.